Hi, my name is Dr. Kaur. I'm a naturopathic doctor at Tustin Longevity Center, and today I'll be sharing a story about a patient case with you. One of my patients, we'll call her S, so we're not violating any HIPAA laws. She came in about last year, January. She's about 40 years old, and her weight was about 279 pounds. And some of her chief concerns she complained about, she said she was diagnosed with polycystic ovarian syndrome. That's where our ovaries, they start developing cysts on them, but it can also make you more prone to gaining weight, developing diabetes, and causing fatigue as well. And she complained of that too. She said she was very tired, and she was also having some insomnia, trouble falling asleep and staying asleep, and a lot of GI issues too. She was getting a lot of gas and bloating. So we ordered some blood work on her to kind of see where things were, what's going on. And when we did her labs, some of her inflammation markers were really high. SED rate, it checks general inflammation all over the body, and the goal is to have it less than 20, and hers was elevated at 23. And HSCRP is another inflammation marker. If it's high, it could put us at risk for heart disease. And hers was about 24.7, and the goal is to have that less than 1. We also tested her sugars. We did something called hemoglobin A1C. That's your average sugar level over the last 3 months. It checks the sugar that's attached to our red blood cells. And red blood cells, they change over every 90 days or so. And hers was really high. It was at a 14. So that means she's a type 2 diabetic. Anytime if it's higher than a 6.5, that puts you into diabetes. So, and then we also found that she had hypothyroidism. She had a low thyroid as well. Some of her other hormones were also low. She had a deficiency in DHEA, which is an adrenal hormone that helps her body handle stress better. She was also deficient in vitamin D. Her vitamin D level was at 12. And vitamin D, it's going to help our immune system, help our bones. And at our clinic, we prefer that the level is about 80 to 120 to prevent disease from happening. So right away, we had her come in so we can go over some of these blood work and go over some of the changes we're going to start making. Another thing we also discovered is that her blood type is A negative. And a lot of my A's, we noticed that they have a slower digestion. They have a hard time breaking down their protein, fats, and carbs and absorbing the nutrients properly. So when she came in, we started talking about diet. She was actually a vegan, but she was very open-minded to changing her diet because she understood that a lot of the food she's eating is causing diabetes because of her carb intake. So we discussed doing intermittent fasting. That's where we give our body a 16-hour break and allow it to start healing ourselves. So she's going to stop eating dinner at 7 p.m. and not have anything the next day till about 11 a.m. What that does is, for example, anytime we eat carbohydrates, our body releases insulin, and insulin's job is to break that sugar down, but it stores that sugar in our fat cells for later on for storage. However, over time, if I keep eating carbohydrates, I'm never burning through that storage, so that storage will get bigger and bigger. And that's what's causing her body to become resistant to insulin and leading to diabetes as well. So what we did is we did the fasting. So during the fast, she can burn through that fat storage she has and also start on a low carb diet where she started eating good healthy proteins, organic grass-fed meats. She incorporated a lot of green vegetables to get a good amount of fiber in, and also some healthy fats. And then I also put her on some nutrients. We gave her digestive enzymes to allow her body to break that down, the food better and absorb it. I also gave her systemic enzymes. Those work differently than digestive enzymes. They work all over your body. They help reduce inflammation and improve circulation. And those are important to take on an empty stomach so it doesn't work on the food. It can work on the whole body. Then I also gave her some B12, vitamin D, and DHEA. For thyroid, we supplemented her with some Nature Thyroid. It's a natural form of thyroid medication that has both of the thyroid hormones we need, free T3 and free T4. So she was very regimented about following this plan. She started the plan in about March, and then I saw her back in August. And when I met her, she's lost about 30 pounds all on her own with her diet without any medications. And her A1C, her average sugar level over the last 3 months, it went from a 14 to 5.7. And that's incredible because it's even hard to break it down to about a point every 3 months or so. So that was a big improvement. Another thing she did is her triglycerides were really high. They were 333 and now she's down to 190. And her vitamin D has come up, it's about 50. Her DHEA and thyroid have also normalized. And another beautiful thing is that her HSCRP inflammation marker has gone down to a 9.9. And remember, it was a 24 before. So she's doing wonderful. She's going to keep up with her diet, her nutrients, and we'll probably be seeing her sometime this month so we can follow up on that in the future. Thank you.